This is Damian McNamara reporting from the South Beach Symposium in Miami Beach. And with me is Dr. Susan Wankel, who is a private practice dermatologist in Bradenton, Florida, who does both Mohs surgery and cosmetic dermatology. Dr. Wankel, thank you for being with me.
Thank you so much.
Now, you reported here at the meeting on an innovation that's made a big difference for your filling technique. Can you tell me more about the blunt cannulas?
Well, I can tell you that after all these years of injecting various fillers, the one thing patients hate is a bruise. They don't like the telltale sign that they've been injected. And the new technique of injecting with a blunt cannula that is not sharp, you can't even put it in the skin without a needle puncture first, and then put the blunted cannula in through the needle stick, through the hole of the needle stick, and inject that cannula, and it pushes the vessels away rather than puncturing the vessels, so we see much less bruising. You see less edema, less bruising, so it's a atraumatic approach to injecting soft tissue augmentation.
Dr. Wankel, can you tell me how you came upon this technique?
Well, I was fortunate to go to a meeting called IMCAS in Paris last January. It's when I first saw the cannula. I thought, well, this is interesting, looks a little tricky, maybe not. Then I went back to IMCAS this January, entire day of live injection session, not a single needle on the podium. So I came home and said, this has to be important to learn, and decided that I would incorporate it into my injection technique. I will tell you, there's a learning curve. It's not easy at first, always getting the cannula in through the skin, but once you get the cannula in the skin and just gently progress through the tissue with the cannula, it's so atraumatic. It hurts less, it's not puncturing anything, it's not hurting anything, and it very gently can lay down the product. You, I think, compromise a little bit in precision because it's not coming out the distal tip like a needle, it's coming out the side of your cannula, but you can certainly learn to work with it. It's wonderful filling areas like the pre-gel sulcus that often bruises in this area. In the cheek, from one injection point here, I can actually fill the mid-face, turn around and fill the cheek, and go south and fill the nasolabial fold. So it's amazing, it's because it's a longer cannula that often we've injected with half-inch needles. And now we have a 1.5-inch cannula that you can reach with fewer percutaneous sticks a huge portion of the face for injection.
Now, one of your points is that it's a little challenging at first, but to kind of stick with it, is that what you're saying?
It's a learning curve with everything, and I think that it takes a little more time, but the benefit to your patient is well worth it.
This has been Damian McNamara reporting from the South Beach Symposium in Miami Beach.